Hello, my name is Emma Remy, and today I'm going to be doing my skill initiating a peripheral IV access. I'll be practicing general principles and safety practices throughout my whole skill. I'll be doing the 3 medication checks and the 11 rights of medication administration. So first thing I'm going to do is my 2 medication administration checks. So I'm going to go look at my MAR and look at my patient's order and pick out the right order, which they are ordered IV solution. And then now that I've pulled out our IV solution, I'm going to make sure it's unexpired, unopened, and clean. I'm going to check it back to my MAR, and they all match. So now I'm going to go into my patient's room with all my supplies and perform my 3rd medication check. So I'm going to be assessing my patient for 2 patient identifiers, checking that against our IV solution and that against their MAR, and they all match, so we are good to go. I'll also be assessing my patient for any allergies they may not have listed in their chart. Alright, so now that we are in here and we have our supplies, I want to go ahead and spike my IV bag. So I'm going to perform hand hygiene and get my IV solution out. My IV tubing. I'm going to go ahead and untangle it. Alright, I'm going to get my IV bag. Maintaining aseptic technique and not contaminating my IV access port or my spike, I'm going to remove the top to my IV access bag, the port. Then I'm going to be removing my IV spike cap. And maintaining aseptic technique, I'm going to get that spike. And I'm going to use a twist push method to spike my IV bag. And my IV clamp is locked. So now I'm going to turn this up, down, and hang it up. I'm going to fill my drip chamber up halfway so that we can see the drip rate. Alright, and now that that is done and the bag is spiked, I'm going to get my IV tubing, ensuring that there's no kinks in my tubing. Alright. And to keep this clean, I have my port cap still on my port, so we're going to prime through that. So I'm going to unclamp my IV, watching my tubing, ensuring that there is no air bubbles or anything in my tubing. There's no kinks and everything is flowing good throughout it until it's fully primed, which means there's no air bubbles in the tube. There aren't. So now I'm going to clamp my tubing. I'm going to hang it to the side to get it out of my way, and we still have our port cap on it, so it is still clean. I'm just going to tidy up my area. So now that we have prepared our IV solution, I'm now going to initiate my IV access. So I'm going to perform hand hygiene and get my IV supplies ready. So I'm going to be doing my J-loop first. So I'm going to be using normal saline to flush out my J-loop, to prime my J-loop. Alright, so to get our hub out, we're going to open it carefully to not contaminate the hub or the package. I'm going to grab it and not contaminating the hub. I'm going to take my saline lid off, and I'm going to connect these two without contaminating them. Alright, now I'm going to go to my protective piece. I'm going to take off my protective piece because later on we'll not have time to do this when we are trying to occlude the blood. And now I am going to prime my J-loop, making sure there's no air bubbles in it. Alright, and now that is primed, I'm going to go back into my sterile clean package, open it, and set this port in there and close it, so now that it will remain sterile and clean. Alright, and now that we have that ready, I do have my IV start kit. Okay, so I'm going to perform my hand hygiene, and I'm going to palpate for a good appropriate vein to use on this patient. Now that I've selected one that I'd like to use, I'm going to perform hand hygiene and don my clean gloves. Now my clean gloves are donned. I do not want to put my tape on my table, so I'm going to put my tape on my glove, which we can do. This is the tape we'll be using later on. All right, and now that we have that tape ready, I am going to get that vein, my site, get my tourniquet out, apply my tourniquet 3 to 4 inches above that site I just selected. And this arm, an arm would be longer, so my tourniquet would be 3 to 4 inches above my site. Right, now that we have our tourniquet applied, we don't want to leave it on for too long, so I'm going to check for radial pulse, ensuring that we still have blood flow on our patient's arm. All right, and now that I have checked that, I'm going to get my IV start kit and get my facility approved cleaner. I'm going to pop it. I'm going to clean however long according to manufacturer's instructions, and let it dry however long according to manufacturer's instructions. And now that my site is cleaned, I'm not going to touch it, so I'm not going to contaminate it. So now that I have that ready, I'm going to get my gauge out. I've assessed my patient's vein and the solution we are using, so I've decided on 22 gauge today. To get that out of my packaging, using my double OK method, I'm going to open my catheter. I'm going to hold the skin taut 3 to 4 inches below where I'm inserting it at. At a 10 to 15 degree angle, bevel side up, I'm going to insert my needle, my gauge. And once we get that blood return, I'm going to advance my catheter using that slide thing on there, the slide plastic thing, and we're going to pop our tourniquet, and we're going to occlude our vein. I'm going to get my needle and engage the safety. As soon as we have the safety engaged, I'm still securing my hub. I'm not touching my site. I'm going to get my J loop out. This is going to occlude our vein. Now that I have it on there, I can let go of my occlusion. So now I'm still securing my hub, not touching my site. I'm going to get a piece of my tape I have set out and secure that hub down. That catheter down. Now that it is secured, I'm going to go ahead and get my normal saline. I'm going to flush a little bit, aspirate for blood return, and then flush fully. And while I'm flushing, I'm going to be inspecting my IV site for any complications such as infiltration. And we have none. So I'm going to take my saline off. Since we're going to be cleaning this hub before I attach it to my IV fluids, we're just going to set it to the side. Now that our IV access has been started, I can secure it down with extra adhesive as needed. So I'm going to put down just a piece right there for extra security, and get my Tegaderm out. Alright, so now we have our Tegaderm on it. I'm just going to go ahead and put my hub over here and get my other piece of tape I have. I'm going to tape it to secure it down. I'm not going to tape on the Tegaderm so I don't ruin it. This tape is really sticky. Alright, so now that my hub is secured, my site looks good, I'm going to label my IV access site with anything the facility may want me to label it with. So now that we have started our IV access, I am going to go ahead and hook our IV fluids that we prepared to my IV access. So I am going to get an alcohol wipe. I'm going to scrub my hub. And while we are letting that hub dry, I am going to go ahead and get my IV tubing down. Maintaining aseptic technique and not contaminating this or my hub. You want to get a little closer for this with my face on the camera. I'm going to take off my cap, keeping my port cleaned. And after my hub has dried, I can attach my port to my hub. And now that that is connected, I can go ahead and unclamp my IV. I can set my flow rate per order and assess my flow rate in my IV site for any signs of infiltration or any complications. and I am going to document this procedure immediately after I have performed this. I'm going to document whatever the facility wants me to. I'm going to check the right response for my patient for this procedure, and I'm going to remove my hands and always perform hand hygiene. Thank you.